All right, I think we're ready to roll. I hope everybody can hear okay. Thank you for joining today. First of all, before we get going, whatever you're doing, stop and go wash your hands. We'll wait for you. Just go wash, scrub. All right. So glad everybody could join today. Thank you. This is thanks for doing this even and appreciate how much NARC has been doing to put on these webinars in such a short span of time since the world started going a little bit crazy. So thank you for joining. This is NARC's third webinar and conference call on how regions can and are responding to the COVID-19 epidemic. So again, glad you could join. These are unprecedented times and frankly, a bit surreal. And I can only imagine, given all the protocols in place, where you all may be calling in from. And then again, maybe I actually don't want to imagine too much where you're all calling in from. I'm just glad you're on the call. My name is Ty Warner. I'm the Executive Director of the Northwestern Indiana Regional Planning Commission, and I'll be the moderator for today. That's my smiling face right there. It's a good thing you can't see what I really look like at this particular moment. So you can just imagine that's who's talking to you. I'm in the relative safety of my own home as we began remote staffing operations ourselves as of Monday. We're joined by three other executive directors today who, just like I think pretty much all of you on this call, are dealing with a range of issues related to maintaining operations and providing your member towns and counties and cities with all the types of assistance that your members require during this particular pandemic, which again is pretty unprecedented. So we're all trying to get through as best we can, and this is a great opportunity to help share some of that. On this webinar, who are going to freely share some of the experiences they've had already, we have Lyle Ray, who's the Executive Director of the Capital Region Council of Governments. We have Brian Martin, who's the Executive Director of the Miami Valley Regional Planning Commission. And we also have Kathleen Lamaco, who's the Executive Director of the Southeast Michigan Council of Governments, who, if all goes as planned and we don't have this stretch on a ridiculous amount of time, we'll be seeing in person in the conference in June. Just as all regional councils don't look exactly like any other, each of these three regions that we'll be cycling through today are facing unique issues all of their own, but also have some experiences to share that may be of benefit to those of you who have joined us, and we'll talk through over all of those over the next hour. This is where I might say, but first a word from our sponsor. But in this case, I'm going to be saying first a word about the pandemic, which I suppose in some ways is the sponsor, and that's the reason we're all here today. As everyone on this call knows, the number of COVID-19 cases is increasing substantially and rapidly. You can see that all on that map, the spread of all those red bubbles there. And it's an exponential growth. According to Johns Hopkins University's website, COVID-19 can be found in more than 156 counties. It has infected nearly 200,000 individuals and has resulted in more than 8,000 deaths worldwide already. In just the United States, we have nearly 6,500 cases and 114 deaths in all of the 50 states now, including the District of Columbia and Puerto Rico. Local and state governments and regions are all developing policies and practices to respond to the coronavirus. Governments and regions like yours are all developing a range of guidance for workers, residents, businesses, the general public. And everyone is in the process of developing consistent messaging, I think, designed to keep the public informed. Those include things like, you've heard this list many times, self-isolation and social distancing are the new norm. Teleworking, when possible, has also become the new norm. Restaurants, bars, gyms, theaters, other public venues, all being ordered to shut down or at least banning dining in, going to takeout only. Governments in the San Francisco Bay Area have established shelter-in-place rules, and hospitals and physicians around the nation are calling on states and the federal governments to make available medical facilities and supplies. Again, these are just strange times for all of our regions. And with that, I just want to take the opportunity to thank NARC staff for setting this webinar has the goal of providing you with deep and relevant information on what your colleagues are doing to ensure, in this particular call, your continuity of operations, how you can help support your member towns, cities, and counties at this time, and how what role you might be able to play in public outreach. So again, we'll be hearing from 3 regions about what they're doing organizationally in these weird and strange times that we are in. So I didn't mean to use weird and strange as a segue into our first speaker, but here is Lyle Ray. Let me turn it over to Lyle. Lyle, again, is Executive Director of the Capital Region Council of Governments. Lyle, take it away.
Thank you, Ty. Capital Region Council of Governments is located in Hartford, Connecticut. Just to refresh, we have 1 million people in the region, and we do not have any counties. So it's we're the only thing between the state and towns, which is relevant to the kind of role we're trying to play. So let me just go over a few things. We started out by saying we want to minimize the amount of noise. I don't know about you, but I'm getting like barraged with emails on how prepared everybody is on COVID. So I'm getting clogged with all that. So we wanted to make sure we minimize the noise and provide good information. And one example of that is we sent this yesterday to NARC, and that is that the Harvard County School of Government came out with 20 good points for decision makers on COVID-19 that are really good summaries. So we were trying to keep our elected officials, mayors and first selectmen informed on summary documents rather than barraging them with vast numbers of pieces of material. The second piece beside noise is we're trying to identify gaps. If someone has already handled it, we don't want to do a lot of me too and send the same thing over and over and over again. And then we've been facilitating a lot of work at the local level. So we helped towns set up electronic meeting with things like Zoom, software and other kinds of things, as well as doing it ourselves, and also helping prepare localities to operate by people working at home. And so we've, as early as today, as late as today, we sent out a draft regulation on setting up an emergency declaration at the city or town level to complement national and state ones. And there's some reasons to do that. And again, we gave a first draft that has to be adapted to every town's charter, for example. But they have a first draft that gives them a pretty good start on that. So some of the things, just quickly, we had dumb luck, and plus Pauline Yoder on our staff was ahead of the game. So 10 days ago, we started preparing to work from home. And we had set up, we have Office 365, we have SharePoint portal with Microsoft. We don't use Teams, which very much, we're using it. And our phone system is a voice over internet protocol phone, which you can take home and plug into your router at home, and it works. It doesn't know you're not in the office. So those 3 things, Office 365 and SharePoint, plus the voice over internet protocol phones that could work perfectly well from home, where you get messages, they show up on your email and so on. And then the other aspect of that is we have a very robust internet system, the state Connecticut Education Network that's like hundreds of gigs and very, very good. So the internal preparation we started 10 days ago. We issued a staff guidance memo. This is also covered in our personnel manual, but we had some guidelines for virtual office. A number of people had worked at home occasionally, and some had not. So just a couple other points. Since we don't have counties, we are the emergency management operations center for the region. So we have 38 towns and 1 million people. So that was activated 8 or 9 days ago. So the good news is we're kind of plugged into all the thinking of FEMA and the national government through our emergency operations staff. And as a matter of fact, they have a conference call next door to me, so I had to close their door. So that's been a big plus. So we're working very closely on that. So for example, they found that the emergency management folks found there's 20,000 masks sitting in a warehouse somewhere in Connecticut. I won't get into the details, but if we were not plugged into that emergency operations system, we wouldn't know that. So that's another piece. So I guess just going over the last point is we try to be collaborative with others and not cause additional chaos. So we have an organization called CCM, which is the Association of Cities and Towns. We have COST, which is the Association of Small Towns. And then we have the Connecticut Councils of Government. So those 3 groups have been working together and putting information out back to the administration, and we have an attorney sort of giving us guidance. Just to give you one negative example, so we had a memo from the Secretary of the State on election provisions in COVID-19, and the ink wasn't even dry on the email, if I can mix that metaphor, before the governor's office said, hell no, that isn't right. So we basically then had to loop back and make sure that policies are vetted across the whole of government approach, as well as the local governments in terms of the regions and the towns. So that's been a useful piece, and we have a continuous email chain with all those people coordinating. So when we gave our draft bylaws on emergency declarations, that was shared across the state. And we have been a clearinghouse, maybe I'll end here, but a clearinghouse for things coming up from towns. And as you can imagine, there's a myriad of waivers and legal opinions and executive orders that are blasting all over the place for everything, from extending driver's licenses expiration dates to open meeting laws. We have a waiver of open meeting laws in the state, for example. So we're trying to be a clearinghouse to get that information into this process of the governor's office, the councils of towns, and the regions. So we're not duplicating it, and we're, as I say, trying to minimize the amount of noise, because I think local elected officials are kind of in a frenzy to manage 1,000 things, and the last thing they need is 200 emails in their inbox that are saying the same thing. So that I think the why we're different is we don't have counties, so we're having to step into some of the things that a county would do. The good news is we are the emergency management consortium for the region, so we're plugged into that, and we are working collaboratively with our towns and other regions and the governor's office in the state to stay on top of this. But that doesn't mean things aren't bubbling along. They certainly are. And as you well know, things are changing almost on a daily basis. So on Tuesday, for example, I was listening to the governor, and this is my final point, on talk radio at 8:30 in the morning. And by 10 o'clock, he issued an executive order stepping up a whole bunch of things. So then in 90 minutes, things change. So it's a little bit like that right now. We've closed, as Ty was mentioning in the beginning. The only thing that could happen more would be sheltering in place, and we have not done that yet. So that's where we are, and look forward to hearing what my colleagues have to say. Thanks.
Great, Lyle. Really appreciate that. Let me just put out a teaser, and Lyle, if you might be willing to share the emergency declaration draft that you gave to your local governments. I'll be at the end of this webinar, we'll be giving a resource where that sort of thing NARC staff will be compiling. So I'll give that at the end. But
I'll send it to NARC right away. Yep.
Excellent. Thank you. Let's move on to Brian Martin. Once again, Brian is the Executive Director of the Miami Valley Regional Planning Commission. Brian, thanks so much, and it's all yours.
All right. Thank you, Ty and Lyle. Thanks for your good points. I am in Dayton, Ohio. The Great Miami River flows through our region, so not to be confused with Florida, obviously. No palm trees, just brown fields and interstates for the most part, and brown rivers. But like everyone else, we're dealing with this very strange virus, and we're just trying to stay as healthy as possible. Our governor has been providing daily updates across the state and beyond, obviously. We are a regional planning commission. In Ohio, that means we are a unit of local government. So I've been working hard to stay in contact with my members, all the 55 cities, villages, townships, counties that make up MVRPC. None of them have been closing. They still have, they're still open. So that was my rationale for keeping my staff in the office, although I am encouraging use of sick leave, liberal interpretation of that. So I came out with that policy on Monday. Today, we just had a discussion about going to a virtual office and testing that on Friday and on Monday, the two coming up, Friday and Monday. So far, so good. We've never done this with our system. We're going to try it. We're not under one umbrella. I think we have several legacy pieces of software. And so we're going to see how it goes. Although most of our system is on Microsoft, and we have a short tail system that's about 6 or 7 years old. So we're going to try it. Instead of plugging and playing with our short tail phones, basically we're going to have those forwarded to cell phones. So we can let everybody know how that goes on Friday and Monday. Really what I'd like to get out of this is, the office is going to stay open. There'll be about 5 or so people here on a regular basis. I'll probably be in some days and out, other days working from home. It just depends on how the systems stay in place. So I've got a couple of policies that I can share with the NARC staff in regard to our liberal interpretation of sick leave, since it is a virus, as well as the virtual office. Our biggest thing has been operations and conducting business. As I said, we are a unit of local government. The state's guidance on meetings really doesn't work for us. In Ohio, you can have a meeting and keep out the public, but stream on Facebook or some other electronic process. But then on the other hand, when we get together, we have between 50 and 70 attendees, which is affected by the CDC's guidance on fewer than 50 getting together. So far, I have TAC tomorrow, our technical advisory committee, and we're going to do that telephonically. Although the guidance is not crystal clear here in Ohio on how to go. Basically, we have a memo that's curiously worded from the Attorney General. We have encouragement from the governor. So we're going to try this with our TAC. And in my mind, we're doing it for all the right reasons. We still need to conduct business. And if I'm wrong, then it's TAC. We can throw it away, so to speak. And our board meeting's in a couple of weeks. But we're on a July to June fiscal, and we're an MPO. So I'm sure most of us have work programs that need to be adopted and tips that need to be approved and so forth. So we're going to inch our way into it and see how it goes. But overall, I'm kind of the morale officer with staff. We have folks that are very concerned about contact with others and germs and so forth. We have others that aren't as concerned. But the good thing about us is that we all have doors. We all have walled offices. We're not in the 5-foot high wall cubed environment. So that certainly helps. And we have the whole floor in our building. I'll leave it right there. These are interesting times, and I'll pass it on to Ty.
Great, thanks a lot, Brian. I really, really appreciate that. I think all of us, I know for my own staff as well, and I'll just opine on this before turning it over to Kathleen. And I'm sure we're all being sensitive to the staff that are in our charge. The ranges of responses, truly have been across the spectrum, from those that think a lot of this is overblown to those who I described one of our staff as almost literally catatonic, walking around in such a concern about all this. And so just wanted to seize on something Brian said to just comment that, of course, we have to show a lot of sensitivity to where our folks are at and try to make policies and plans that can try to address the vast range of emotional states people are in. And that's just sort of the management responsibility I think we all share.
Yep.
Yeah.
With that, let me turn that over to Kathleen, who's the Executive Director of the Southeast Michigan Council of Governments. And again, Lord willing, if this doesn't extend all the way through June, we'll be our gracious host coming up for the annual meeting at NARC. Kathleen?
Yes, in fact, the NARC staff and our staff had a conference call today talking about the conference. So we are hoping that this issue gets resolved and it allows people to travel in June, because we've got lots of fun things planned for you.
Awesome.
I thought I would just quickly share with you where we're at. We responded pretty quickly to what was kind of an evolving and changing situation, and we started thinking about it last Thursday. And at that point, we said we need to get ready to make sure that more people feel comfortable working remotely. We've got a lot of people working remotely on a regular basis. Some of our staff work remotely 1 day a week. We have one of our managers that in fact works remotely three weeks a month because she lives in northern Michigan. So we've got the technology in place to accommodate it, but we really thought initially that we would encourage more people to work remotely and have a skeleton crew. That was on Thursday, so we had prepared to have a training session with our staff on Friday to make sure everybody's laptops and cell phones were all set up. And I should say that we all have laptops and cell phones because we don't have anything wired within the office, so it's easy for us to take all that stuff home. On Thursday evening, our governor canceled all the schools for 3 weeks. And it was at that point that we really realized that, we've got a number of people with small children that aren't going to be able to come to work very easily, and that the situation was getting worse. So at that point, we decided to change our message to staff when we were going to be having that training session and have all the staff work remotely. And so that's what we did on Friday. We made sure that everybody was familiar with the systems. Many of the staff are. We did a little bit of training on some of the various conference calling and webinar technologies so people know what's available. We shared the names of the staff that have experience with those systems so that people could contact them. And we went all remote starting on Monday. Some of the other things we provided to them were we have a lot of how-to guides on our intranet system, so we've added some of that information, and we also added. We know that in many cases our planners can keep themselves very busy working remotely for the 3 or 4 weeks that we're going to be working remotely. But for some of the other positions, we started putting together a list of activities that, for example, the receptionist or people that are generally out working with our members or planning meetings. So we've got a collection of those type of activities that we've compiled, and we'll be sharing with staff as they need additional things to do, because we want everyone to feel comfortable being at home and knowing that there's work to be done. So that's what we did in terms of kind of business continuity. In terms of managing, we continue to have our kind of routine staff meetings using conference calling or webinar technology. And we have a small group of 6 of us that have a pretty tactical call every morning at 8. I think part of that is to ensure that we keep sending consistent messages with our staff and address any issues that arise. One of the things that I see my role as, and I think some of the other speakers mentioned it, is just trying to calm things down. That while we can do a number of our work activities remotely, communicating a lot with our members when they're very preoccupied with this, particularly on longer term planning issues. We're not their top of mind. So we're monitoring the situation, figuring out what are the types of things that our members are interested in hearing from us about, as well as preparing for a time when they are going to be have the time to address kind of the regional planning, intergovernmental coordination activities. We're also externally, as we monitor what our various local governments are doing, are collecting kind of serving as a clearinghouse, collecting examples of practices that the various local governments might want to deploy. I think similar to NARC, they're sharing with what we do with each other. We're talking to our members, finding out, how are they delivering their essential services, and a number of them have the issues. How are they deploying the staff that aren't providing essential services and can't do their jobs on a day-to-day basis? We have a number of city halls that are all basically closed down. So some of them are doing things like having their non-essential staff help deliver food to the homebound. We're having some of them make phone calls to their senior citizens, finding out if they're okay. So we're collecting those type of activities and sharing them with our members. One of the things, half in jest but half serious, is that we're working with our water providers who are concerned about all this shortage of toilet paper and wanting to make sure people don't throw things other than toilet paper into the sewers. So we've got a lot of video footage of how the sewer system operates, so they're going to be doing some public information videos that we can get posted for the general public. And I guess the last thing I want to say is we're looking at this in some ways as an opportunity to think about our management structure, think about how we manage. Some of my managers are saying this is a chance to reset expectations in terms of how we report and communicate with each other. So we're going to be doing some thinking of that as the next couple of weeks. And we're also thinking about kind of what are the longer term implications in terms of how people work and where they work. I know that when I just recently signed our lease extension, and one of the things that in doing it, given that we always have a number of people that are working remotely, do we need as much office space as we have? And I think after this is all done, we're going to be able to evaluate if that's something we're going to see other businesses doing as well. So with that, I will close and would be happy to answer any questions.
Super. Thanks so much, Kathleen. We will get to questions here just at the end, but really, really appreciate all that. Let me just follow up with that for a few things that the Northwestern Indiana Regional Planning Commission has done here. We, like Kathleen said for her as well, and like many others, we went to a remote situation starting Monday. We had an all-staff meeting and laid out how things we thought would work, and we kind of mobilized right away for folks to be able to collect what they needed and be prepared to work from home. We essentially said at least plan on through the rest of March, but we'll just be staying in touch and figuring things out from there. Like others had already said, we did have some tools in place that were helpful. We were already on the G Suite whole platform, so we already could log in from any device pretty much anywhere. We also had integrated dial pad software for our phone system, so that was easy for for the app on people's phones, to call out and still appear as if you're using your office line. So that stuff was already in place, and we had already started working our workflows through Monday.com, if you're familiar with that. And it hasn't been, absolutely adopted everywhere, but enough of the workflows at NERC had started through that process. So we had a lot of things that were already in place that made the transition easy. Monday.com integrates really well with G Suite. So we had already had a work at home policy that we had made available, of course, that people could take advantage of before things got even more pronounced with the different protocols and whatnot. But then Monday, we switched that to say, okay, this is not just an option for you, this is actually the expectation. And I'm actually strongly discouraging coming back into the office. Although we do know there's going to be situations now and then, something's got to run in real quick. And I was very clear, if you're showing any signs of sickness or have been around anybody who has been sick, not to step back into the office so that environment can stay safe. We had a bank of laptops already for those that did not already have laptops issued to them that we were able to refurnish, and our IT provider consultant person was able to come in and install those with VPN, virtual private networks, to access on the server what couldn't already be accessed through Google Drive and through the G Suite. So that was kind of our mobilization story. I will say, I don't know how much of this is widespread, but I don't know how many other organizations in Northwest Indiana went working from home all of a sudden too, but our first full day of it yesterday, we had a lot of network issues on the cellular network. So people experienced some surprises where they thought it'd be easy working from home. We had some data problems. Seems to be much, much better today. So I don't know if that was a temporary glitch or not, but I have to confess, my first thought was this is not boding well for our next 2 weeks, 3 weeks, 4 weeks, whatever it's going to be. But it seems to be working today. I literally, and I'm not making this up, yesterday there was so much going on I needed to respond to, and I was having connectivity issues myself since I happen to live in a pretty rural area of our region. I was literally in my car with my laptop sitting in front of Wi-Fi locations trying to get things done. So I spent a good time of the day lurking, I guess is the term, right? Outside businesses, but we got through. I will just put out here, because it seems to be working for some of our staff. If you weren't aware of this, Comcast has made their Xfinity system, at least in theory, free, whether or not you are a Comcast subscriber, for 60 days. So if you look for a hotspot, not just the one that says Xfinity, but Xfinity Wi-Fi, that seems to be working. So that goes off of whoever's got an Xfinity system within their home or business. So you can actually map those out and get close to those, or see if there's one nearby, if that helps your staff through this. Just real quick before moving on with the rest, we actually, during the talk that I had with staff on Monday, we actually went through some things. Certainly, there's plenty of work to do that we can not skip a beat with online. So it's not as if we expect that anybody will be bored per se, but we did happen to have some things that we were able to say, hey, this is a brilliant opportunity to be able to take advantage of. For one, it so happened we had actually mandated some online harassment training courses that had a deadline at the end of March anyway. So it just happens to work. This is a great opportunity to do those. And we had just signed up staff with some career training memberships for some online webinar training resources of their choice. And so prime opportunity for training during this time as well. And then I mentioned Monday.com earlier. It's just also working out to be a good opportunity for those that have not fully invested themselves in how to best maximize that system to do things like that. So that may be an option too, just to give folks some ideas of, these are, in these weird times, this is an opportunity to catch up on some of that sort of thing. Just a couple other quick comments. We do have 1 or 2 non-exempt staff that are paid hourly, and so we have struggled a little bit to try to figure out how to deal with those 2 staff people during this time, since we're not having anybody in the office, where it's a little less clear about how they can function in an online environment, and we're probably not alone in that. So if you have some thoughts, I would be very open to hearing about how you might be handling that in your situations. And then we also, you may have come up against this too. I'm sure we're not the only ones that had a deadline of April 1st for some Title VI documentation for our FTA funds. And we were supposed to approve everything this month in a meeting that of course got canceled given the governor of Indiana's proclamation about gathering sizes. So we're working through that too and submitting things to the FTA just with the explanation. Obviously, these are unique situations and we have a commitment to get board approval as soon as possible. Our governor also just did an executive order just yesterday making certain provisions for public meetings. Just had a call with my attorney this morning. We're not quite sure if that and how that applies to our status as a regional council, even though we are a unit of government. So we're figuring that out, but those are just some examples of some of the challenges during this time that I would love to hear other people's experiences with. So we are going to be moving to questions and answers here, but before I do, Eric Zimmerman, our esteemed NARC's esteemed deputy director, is on the call as well. You can't see him, I think, but I can see him, and he's in his jammies. I wasn't supposed to tell you that. But he's looking good. They have little trains on them and they're awesome. So Eric has a few questions to ask the group regarding, I believe, non-metropolitan planning councils. So Eric, looks like you're on and ready to go. If you want to jump right in, feel free.
All right, thanks, Ty. The thing you can't see is that they're footy pajamas too. So thank you so much. This has actually been extremely enlightening to hear some of the rapid response that you all have done. One of the things that we are doing as staff is putting together some outreach to members of Congress. I'm sure folks are very well aware that there continues to be movement toward a third and then probably a fourth stimulus. Probably that fourth one is where we're going to see some movement toward funding for infrastructure projects and other related things. So I wanted to take an opportunity here to tell you just very briefly, we are working first in coalition with the LOC Coalition, where we are focused primarily on increasing funding for the Surface Transportation Block Grant Program and encouraging Congress to funnel funds through that portion of the program. And then secondarily, we're also working to put together a separate request from ourselves, AMPO, and NATO, the three organizations that primarily deal with metropolitan and non-metropolitan planning organizations, on a separate request that at this point I believe will highlight or will focus on potentially providing increased amounts of planning funds through PL and possibly through the State Planning and Research Fund. And we are also going to put in that letter a request for some leniency or some flexibility on the part of the agencies when it comes to meeting some of the requirements that are going to be the deadlines, as Ty specifically mentioned, on some of the work that they're doing. And I'm sure others have some of those similar deadlines coming up, asking for some flexibility from the agencies in meeting those requirements. And so my request to you, and I won't take a lot of time in this call, I'll let us get to the Q&A, but if you have other ideas, other specific requests that we should make either on the funding side or on the regulatory side to provide some regulatory relief in specific ways, please email some of those ideas to me. My email address is eric, E-R-I-C-H, @narc.org. I will be happy to compile those, but I will stress, as with everything else in this current environment, time is of the essence. We will have to get a letter out very quickly as Congress is going to move forward on some of these elements in the near future. So if you have any thoughts on things that we should include in a letter in either letter, please feel free to share those with me as soon as possible. And with that, I will say thank you very much and look forward to hearing from folks.
Thanks, Eric. Really appreciate that. And let me just say, this is where your membership in NARC, I think, really shines, is being able to compile these things, get the answers you need, and develop a unified response if one is needed. So thank you very much for that. We're going to move to questions and answers, and I'm sure you have some. Eli is going to actually compile your questions. There should be a chat box to the right of your screen. So if you have not already happened to see that and type in some questions, let me invite you to do that. We thought about opening it up, but you know how things go with muting and echoes and all that sort of thing. So we'll try to do it this way. So please use the chat box to go ahead and submit your questions to Eli. Let me just to kind of get that rolling. Let me ask our presenters. I mentioned about non-exempt staff and that. I just wondered if I know, Brian, you said you're semi-open, you're not completely closed and testing out working at home. Or Kathleen or Lyle, anybody that started working remotely, have you had thoughts about how you're handling those staff of yours who maybe aren't as not as easily making the transition to being able to work in an online environment?
Oh, well, I mean, this is Kathleen. We're trying to make sure that everybody feels like they can tell us they don't have a lot to do, because we can help assign them things. I think it's pretty early to evaluate that, since we've only been doing this full time for 3 days. So, but I think we're using it to see how it works, and hopefully everybody will be, open to change, open to feedback. But only time will tell. I think it's for us. It's more that we've got some staff that we're always out in the field or doing things differently, or doing things that don't lend themselves to being on the computer. It's really just making sure we have something to deploy them to do. And I think if all of us look in our operations, whether it's cleaning out our electronic files or photo files, it's, as somebody else mentioned, it's learning, whether it be a webinar or reading or getting, we've even encouraged our staff to get to know somebody on the staff that you don't know. So talk to somebody every couple of days. partly to keep that interaction and sense of community that we're all in this together.
That's great.
Just to,
go ahead.
to add maybe to add a couple of things, we're going to do a weekly review for each of our major supervisors in terms of where things are at and making adjustments. The other thing that we had today is we're going to have a regular online water cooler chat for staff, just so they're not driven crazy by pets or small children. But to have that as a discussion point, and that would be I think an interesting aspect to add to this. But we've had the same issue with some people who are not able to telecommute in the same way as others. They've been given new assignments, and we're going to review those every week. And the same idea is to catch up on development functions or other kinds of things that you've been meaning to do. And again, we'll review it on a weekly basis, but we haven't, we're not far enough into it yet to make any real assessment of how successful we've been.
Yeah.
I mean, I provided a list to the staff we gave people a list of things you might think about doing. So I think they can post that with the other materials.
Mm-hmm.
Yeah, this is Brian.
That'd be helpful.
We're not there yet
Go ahead,
in terms of online. We'll be there Friday and Monday for everybody, except for about 4 staff that will be in the office. Such as our receptionist, our office guy. They both have projects to work on, though, while most of the staff will be away, and we'll all be in contact, of course. Somebody touched on the need for meetings. I do have morning all staffs and then kind of in the day directors meetings. And I'm encouraging my departments to meet with their staff too during the day. So we'll be doing that for Friday and Monday, and I'm sure a lot of the discussion will be geared around IT. But also they can be progress check-ins with the supervisor as well. So we're still in the squirt, in terms of Parallel phase here in the office. But I'm certain that tomorrow I'll probably have about half staff in the office, and others will be going off to either use of sick leave or working from home. But yeah, I think morale and asking people to calm down. I think our office has done a great job with putting in additional sanitation stations here in the building. So we're getting there, but yeah, we look forward to how this is going to work out Friday and Monday.
Great, thanks for that.
Does anyone have a sense of when or how long it's going to take for local officials to be able to absorb kind of the longer term thinking that we're involved in? I mean, we feel like we can't really talk to them about the long-term future this week, but maybe in 2 weeks they may be interested in hearing more about our work, because they're going to all be sick of being at home as well.
Yeah,
Right.
It's an opportunity.
Because our issues are not top of mind for them.
Our towns and cities are thrashing around just doing this very major stuff. So so far, I would say we'll probably surface it in a week or two. I'm sort of on a needs basis. They call us and ask for things, but we're not, hosting large conference calls on issues. I mean, I'm sort of wrestling up my chair for our board meeting next week is sort of about as far as I can get. So.
See, our board was scheduled for Thursday, and we've canceled that. And so we're just thinking about, can we have our, what actions do we really need to take, and when do we need to take them?
Yep. Right. Yep. Yeah, and again, for us, it's compiling deadlines. I mean, towns have a lot of issues. For example, we have a number of towns that have, this being New England, we have town meeting laws where you actually have to pass your town budget by a public meeting. Well, it's not a good idea to gather 500 of your closest friends to talk about a budget. So we're sort of being the collecting point for many of these issues that we get to the Attorney General and the Governor's office and others, and we're getting pretty prompt responses from the Governor's office. But that's sort of the mode they're at right now, which is we're in the middle of the town and city budget season here. So that's in addition to the whole COVID-19 thing. They're usually in a frenzy generally around budget season anyway. So this is just pouring gasoline in the flame. So I'm going to leave them alone for a couple of weeks in terms of having consultations about further activities, but responding to what they have as issues. And then as time goes on, we'd probably, loop back and have a broader conversation.
We're still in disaster recovery mode here from our Memorial Day tornadoes. So my thought long term is to tack this topic onto that as well. We have a social safety net 211 here set up for the region for people to call in, and I know folks are already calling in for the tornadoes as well as for COVID-19. So.
Yep. I forgot to mention one thing, though, that because we're the emergency operations center for the region, police, fire, and emergency medical are already talking. So, they're doing a lot of the strategic stuff at the very specific level. I'm more the chief elected official, the ones I'm leaving alone, but the police, fire, and emergency medical people are working. As I mentioned, they discovered 20,000 masks sitting in a warehouse somewhere. These are the kinds of things they're working through on their own. And so we're being facilitators, but we're largely staying out of the way in terms of not calling additional meetings. So.
Yeah. Eli, are you able to chime in here? I don't know if I can't tell if you've received any questions or not.
Yeah, I can hop on here, and we have received a pretty good number of questions. I'm going to try to answer a few of them quickly that I have responses for. So there was a question about sharing the 20 points document that Lyle was talking about. Yep. I'll make sure that we include that in the follow-up email to all the registrants for this webinar. Brian,
and you have that, right, Eli? You have it. And I'll send I'll have the emergency declaration sent for Ty and everybody else in case they wanted to. Obviously, it's for the state of Connecticut towns, but it's a template for issuing your own local emergency declaration if you haven't already. So
that's great. And I think Eli was about to say this, but Brian also uploaded his memos to the chat, but I think we've got those to send out as well.
Yeah, I tried to start adding some documents to the chat there, but I think they were a little bit too big to load quickly. So I'll just make sure those go out in the follow-up email, and then we will we'll be updating the site either this afternoon or tomorrow on the NARC website. So those will be up there as well. Another question here quickly was, is NARC planning on organizing a call once Congress is passed and the president signs the coronavirus bill? That's a great question. I think our plan is to continue providing these either calls or webinars throughout the upcoming weeks as more news hits and we have more information to share. So yeah, I think that'll be something that we address in upcoming calls. Another question that I think actually you already covered a little bit here, Ty, was how are you handling hourly non-exempt employees? Any special provisions for non-salaried workers? I think that one was covered a little bit. I'm sure there's more to be talked about there.
Yeah.
But I'm gonna read out a couple more questions here, and then maybe we can have the panelists kind of respond to a couple of these. So the next question was, beyond ensuring the functions of the MPO COG, do you envision using Esri and mapping to improve emergency management for your member localities? The question continues, I was at a testing facility yesterday and saw a tremendous need for collaboration with the medical community, MPO, and DOT. I don't think there's a full appreciation of the impact testing has on our transportation system. And can you reconcile this with the traditional role that MPOs and COGs play? I think Sandy is instructive, but this is an unknown unknown. And I'll add on one other, I think, related question here. Somebody asked, sorry if I missed this, but are any of you at the regional level providing information sharing forums for COVID-19 for your elected officials and public agency staff?
Those are great questions. Let me just pause for a second. And Lyle, I don't know if you have anything, given that you're an emergency management.
Yep, I can give you. Yep, I think we're in a little different position since we are the emergency management consortium, and they're doing all that now. They're doing a lot of that coordination already, so that's not different. We have regional bomb squad, dive team, SWAT, dive team, SWAT team, bomb squad, a lot of that stuff is coordinated on a regional basis and equipment. But what we haven't been asked to do yet, and we did this earlier on when we had the Ebola, and if you go back to anthrax and things, we are the medication dispensing strategic coordinating group. But we don't have any medications to dispense. But testing is the issue that I was going to bring up, which is there may be a need to coordinate testing resources. I think it's fair to state that we've done an abysmal job so far on testing. I think we've done in this state 120 tests, which is, like the blood work of a small hospital in the first hour of business. So it's very, very, very slow. But we may be getting a roll. So we're starting some drive-through testing in some of our hospitals, but I think we're going to be asked to help the coordination of a much ramped-up testing program. So that's, I guess, the first thing. I'm trying to remember the other part of the question here.
There was a GIS component to that in particular.
Yeah, we're doing that now. I mean, that's what I'm saying. Our GIS system, we have a regional GIS system. It's not town by town. There's a town version in addition, but we have a regional GIS, and they're using that for emergency management planning. We have, disaster mitigation exercises, and we have, many of these things have been done on a GIS system that is regional. So in terms of emergency management and GIS, we're fine. But I think the coordination of testing may be coming in the next couple of weeks, and that's something we may want to consider as regions as to whether we're going to have a role in helping to coordinate at a regional level rather than a town by town or hospital by hospital. So we haven't had that asked of us yet, but I think it's coming.
Great. Kathleen, Brian, anything on emergency management or and mapping, or for that matter, I think the other part of the rest of the question that Eli read had to do with anything you're doing to help be a resource to your members, information resource.
I forgot to mention,
I mean,
we put up a website. Yeah, website.
We're really working with saying the health departments need to be sending many of the messages, and our county execs are. So we're pretty much out of the specifics of the health crisis.
Yeah, this is Brian. We were already in emergency preparedness mode, again, because of our tornadoes. So we have been reaching out to traditional or non-traditional partners for some time. But yes, at a minimum, we want to start mapping the testing locations and then others. There is a hospital association here, and we've already reached out to them just to see if we can be helpful. Yeah, our GIS is a huge resource, like it is for all of you in your regions. So why not, offer that as a resource?
That's right. That's right. Yeah, just I was actually just thinking earlier today, we have a weekly newsletter, and I was just thinking we need to start putting some links in there to resources. I think Kathleen made this comment that we're also not really in a position, I don't want to get in the way, in some way of those that have much more pertinent ready information. But I will throw out there that, and I'll reiterate this more at the end, but NARC's done a phenomenal job with their site of resources to go to, and I'll give that website at the end here. Eli, some more? You want to try to tackle some more?
I'm going to try to group a few more questions here. They're not perfectly thematically aligned, but we have quite a few questions and we're kind of running out of time. So the first one has to do with remote work and whether you have provided employees with kind of a time frame for how long you are planning on working remotely, or if you're just saying it's for the foreseeable future. And then another question was whether anyone has, the person asked, I was asked this morning from the governor's office to quantify the cost of COVID-19 to our agency, presumably as a part of a request for federal assistance. Has anyone else tried to do this? And then we had another question, which is, I think, similar to that one, is anyone looking at economic recovery issues following this event or series of events? So that's kind of looking ahead when we're hopefully past this.
Those are great questions.
I mean,
go ahead, Kevin.
Go ahead. We're working on, getting information out to our economic development community about resources for recovery and assistance, just to kind of get that dialogue started. So that's the answer to that one question. And the other one is, we told our staff that we would be off till and we're not, our office is not closed, we're just working remotely, but we would be working remotely through like April 10th or something like that week. It's really 4 weeks to go with the 3 weeks of school and the spring vacation.
We on that particular question, I just told staff, plan when we left Monday morning. Said plan on the rest of March, but I was I was careful to say, we may be working remotely, but this is not a communications blackout. We're still very much in touch, so we'll just be staying tuned and seeing how things develop. So we just left it at that. Brian, Lyle, anything on that or on the other two issues where the quantifying the cost of COVID-19 and the economic recovery?
We have not tackled that yet.
We haven't either. I think that those are long-term and strategic questions. I'm sure we'll be getting into at some point.
Yeah, like likely with here. I think Eli, I think we probably have to call this, don't we? Unless you have one other pressing question you want to try to squeeze in here at the end.
We can try to fit one more in. Someone asked, how are you funding staff time where they are not able to work remotely on their funded grant programs?
Yeah, that is a question for us.
We have the benefit of
costs, but
yeah, we have dues and other funding that is not tagged to a specific line item. Some of our smaller colleague COGs are much more up the creek than we are, so we don't have to. I'm not on a, for example, it's part of my liberation is I'm not on a transportation line item. So when people say, well, we don't think the transportation would fund that, and say, fine, go ahead, I don't care. So anyway, to make a long story short, we use dues and other allocations of funds. So we have the ability not to have every nickel go directly to a line, which is a real problem for a lot of small agencies.
Yeah. It's a struggle. I think that is just a very practical question that we may need to just kind of solicit other people's thoughts and ideas. And if you have certain policies in place, I think that would be really helpful to share. That's kind of where the rubber meets the road as we all try to adapt to this new environment.
Right. Many agencies have very tight linkage of hourly allocations for every employee to a specific grant, and if you can't do it directly, you're really getting into trouble. So that's a significant issue. I agree with you.
We're using our fringe pool, and we have a line in our fringe pool, administrative leave, which typically is, jury duty or some other things like that. So we would use that if we get to it, and it would result in upping the fringe rate.
Yeah. Yeah. Well, with that, Eli, thanks for summarizing those questions, and I'm sure there were a lot that we weren't able to get to within this hour. But let me go on to give you some information where we can still have this discussion. So just to reiterate what we've been saying throughout this call, NARC plans to act as a repository for the policies and practices and statements that are being developed by regions, municipalities, counties, and states. And they have a website. If you have not been there already, it's right up there on your screen, narc.org/coronavirus-2019. If you're calling in and can't see the slide, let me say that again, narc.org/coronavirus-2019. They've got a whole lot of information, and they will continue to keep that populated. So just like Brian and Lyle have already submitted some great resources, they'll be posting those kind of things on that site. So we recommend that you go through that and use that for the resource that they intend it to be. So with that, let me close out by just saying on behalf of NARC Executive Director Leslie Wallach and the entire NARC staff, thank you, Kathleen, Brian, Lyle. You all were awesome. Really appreciate your willingness to share what you've been doing on this call. I think that was a big help and gave some good ideas of what you're doing and also some good pointers of what to think about during this really unusual time. Also want to thank everybody on the call for your questions and your discussions, for your interest. As part of NARC's effort to help you address COVID-19, the pandemic, NARC will continue to schedule webinars and conference calls over the next weeks. You'll be at home anyway, so what do you have to lose by calling in? I think that'd be a great opportunity to do this. If you haven't been on enough webinars already, it's a good, these are the best. So join us here. Toward that end, please let Leslie know what topics you feel NARC should cover in the future. NARC has already been receiving requests for conference calls and webinars for communication specialists on crisis communications. They've also had requests on fiscal officers, on fiscal management during the crisis. We didn't even get into things like managing payroll, depending how long this goes on, and all the rest. But those are all in the planning stages. So stay tuned. Again, please let Leslie know of other topics, and she can start planning those with NARC staff. So on that note, check your email for announcements of future conference calls and webinars, and you can be in your jammies or whatever else while you're looking at that, and nobody will care. So if you need additional information about this particular webinar or COVID-19, contact Neil at Neil, N-E-I-L, at narc.org, or Leslie at narc.org. That's L-E-S-L-I-E. And they'll make sure your questions get answered and that your information is posted on that COVID-19 webpage, which again is narc.org/coronavirus-2019. So thanks again for being part of this webinar. Be safe, wash your hands regularly, stay healthy. Remember, this is not necessarily a quarantine inside in this time of social distancing, so go outside and take a walk, breathe some fresh air from now and then, but do remain properly socially distanced. Not to make light of a bad situation, but just because you have to find humor where you can find it. I have been saying this is in some ways a dream state for introverts everywhere. So this is the time to catch up on a lot of things. And try to make the best of what I do understand is a very situation. So with that, there's a right on the slide there, 15 ways to slow the spread. There you go. Follow that advice. Thank you for joining and have a great rest of your day. Stay safe and stay well.
Bye. Great job, Ty.
Yep.
Thanks a
Ty.
lot, Brian,
Thanks,
for your
everybody.
participation. Thanks,
Yep.
Laurel. Thanks, Kathleen.
Ciao.
Great job.
Thank you, Eli. Thank you, Neil. Thank you, Eric.